Hi guys, my beloveds. Today's topic is antenatal assessment of fetal well-being. Okay, so it's a gynecology, of course. My beloveds, you open your exam tickets and you find your exam tickets, board exam, antenatal assessment of fetal well-being. So take your pens, papers, and let's go. So what is antenatal assessment? So antenatal assessment of fetal well-being refers to a series of tests and monitoring methods, my beloveds, that evaluate the health and development of the fetus during pregnancy. These assessments help to identify any complications, ensure the fetus is growing properly, and detect potential risks to the baby or mother. So these assessments are particularly important in high-risk pregnancies or when there is a concern about fetal health. So what do we use? So some primarily methods that we use in antenatal, not we, I'm not a gynecologist at all, but some primary methods used in internal assessment. So cardiotocography, CTG, my beloveds, cardiotocography. So cardiotocography, CTG, is a non-invasive method. So when you talk about CTG, you understand it's a cardiotocography. So cardiotocography is a non-invasive method used to monitor fetal heart rate. VHR, it's a fetal heart rate, and uterine contractions. It helps assess fetal well-being, particularly in high-risk pregnancies or during labor. So what's purpose? To detect the fetal distress, hypoxia, lack of oxygen, abnormal heart rate patterns that might suggest a problem with the baby's oxygenation. So how it works, this CTG? External sensors are placed on the mother's abdomen. The machine records the fetal rate and uterine contractions on a continuous printout. Normal findings, so baseline VHR, fetal heart rate, 106 beats per minute. Remember these numbers, 110, 160 beats per minute. Variability, so fluctuation in heart rate should be moderate, 6 up to 25 beats per minute. Accelerations, temporary increases in fetal heart rate due to fetal movement or contractions. Actually, it's a very good sign. Absence of severe decelerations in VHR, especially prolonged or repetitive, can indicate fetal distress. So indications, routine monitoring during labor, high-risk pregnancies, for example, maternal diabetes, gestational diabetes, preeclampsia, or when there are concerns about fetal health. Yes, ultrasonography. Ultrasound is the most commonly used imaging techniques in antenatal care. It used high-frequency sound waves to create images of the fetus, placenta, and amniotic fluid. So ultrasound is the most commonly, of course, used in the imaging techniques in antenatal care. So technique used high-frequency sound waves, ultrasound, to create images of the fetus, placenta, and amniotic fluid. What is the purpose? Monitor fetal growth, detect fetal abnormalities, assess the amniotic find volume, check placental location, and evaluate fetal movement. Doppler ultrasound is used to assess blood flow in the umbilical artery and other fetal vessels, especially in cases of suspected growth restriction or placental insufficiency. What types we use? 2D ultrasound, standard for routine checkups, dating fetal growth and anatomy. 3D, 4C, now 4D, 3D, 4D ultrasound provides more detailed images of fetal structures, especially useful for assessing congenital abnormalities. Doppler ultrasound assesses blood flow through the umbilical cord and fetal vessels, commonly used to evaluate cases of intrauterine and growth restriction or suspected fetal distress. Indications. So routine scans at the different stages of pregnancy, usually 11 up to 14 weeks for dating, and nuchal translucency, nuchal translucency, and 18 up to 22 weeks for an anomaly scan. Also used to monitor high-risk pregnancies or fetal abnormalities. Amniocentesis is an invasive diagnostic procedure used to obtain a sample of amniotic fluid which surrounds the fetus in the womb. The amniotic fluid contains fetal cells which can be analyzed for genetic conditions or why not infections. So purpose: prenatal diagnosis of chromosomal abnormalities, for example, Down syndrome, trisomy 18, trisomy 13, not trisomy 18, 18, without point, 18, and trisomy 13. Diagnosis of neural tube defects, for example, spina bifida, and genetic disorders. Detect fetal infections and assess fetal lung maturity in the late pregnancy. Procedure. So a thin needle is inserted through the mother's abdomen into the amniotic sac under ultrasound guidance to extract a small sample of amniotic fluid. Risks exist. There is a small risk of miscarriage, approximately 1 in 300. It's not a smaller, 1 in 300, and 1 to 300 up to 1 in 500 associated with the procedure, as well as infection and injury to the fetus. So indications: performed when there is increased risk of genetic disorders, maternal age more than 35, abnormal biochemical screening results, family history of genetic conditions. Controversial, but anyway. And finally, biochemical tests. Biochemical tests involve analyzing material blood or amniotic fluids to screen for genetic abnormalities and assess fetal health. These tests are non-invasive and provide information about the risk of certain conditions. Types. What types do we have? First trimester screening combines nuchal translucency ultrasound and maternal blood tests, for example, PAPP, it's abbreviation PAPPA, and free beta HCG or beta ACG to assess the risk of Down syndrome and other chromosomal abnormalities. Second trimester screening, so-called quadruple test, measures alpha fetoprotein, famous AFP, alpha fetoprotein, HCG, unconjugated estriol, and inhibin A to assess the risk of neural tube defects and chromosomal abnormalities. So first trimester screening, second trimester screening, and non-invasive prenatal testing, NIPT, NIPT, abbreviation, analyzing cell-free fetal DNA, cfDNA, in maternal blood to screen for chromosomal conditions such as trisomy 21, Down syndrome, trisomy 18, and trisomy 13. So indications: routine screening in the first or second trimester to assess the risk of chromosomal abnormalities, NIPT non-invasive prenatal testing is especially indicated in high-risk pregnancies or when a screening test indicates an increased risk of chromosomal abnormalities.